So what is transitioning? It's changing from one state to another. In this case, it's not only changing from pediatric physicians to adult physicians for care, but it also includes a change in who makes the healthcare decisions. The responsibility slowly shifts from your parents or caregiver to you when you are a teen or emerging adult. What age you are when you transition from pediatric to adult doctors varies, and different states have different laws about access for parents to their children's health information. For example, in California, at the age of 12, parents have to have permission from their child in order to have access to any medical record related to reproductive or mental health issues, which can be a really big surprise if you don't know about that. One of our board members was surprised the day after her son turned 12, she could not access any of his test results online. After hours and hours on the phone, she found out it was because the medical record software couldn't distinguish between health records and appointments about reproductive or mental health issues and records pertaining to other health issues. All health records required her son's consent before she could even view them. In other words, it's never too early to start asking questions about transitioning and beginning the process. GOT Transition is a program of the National Alliance to Advance Adolescent Health. They have an easy step-by-step approach to transitioning. There's even a whole website called gottransition.org with tons and tons of information to help you. The first step in transition is discovery. You should learn about your physician's approach to transition. This includes primary care doctors as well as specialists. Do any of your doctors see adult patients? Do they have a team that helps with transitioning to adult care? These are the kind of questions to ask. Other steps in the transition process include tracking, preparing, planning, transferring, and completing. We're going to look at each of these a bit more. You need to know your own health information and start keeping track of your own appointments. ALGSA tools like the Care Navigator, which is coming soon, can be a great resource. Know what medications you take, how often, and the dosages. Know where prescriptions are filled and how often you have to order and pick them up. Know the dates of any surgeries and hospitalizations. Become the person that knows your medical history the best. Your parent or caregiver needs to start letting you take the lead during your doctor's appointments so you can practice interacting with physicians and sharing your knowledge with them. Planning the transition is the next step, and part of that step is looking for adult providers. That includes your general physician or primary care doctor, as well as all the specialists that we tend to have to see. Ask your current team of physicians for recommendations. Put together a list of questions ahead of time about issues that are important to you. If you are planning on going to college away from home, find out what your healthcare options are both on and off campus. Once you turn 18 years old, your family members will need your consent to have access to your medical records or to make medical decisions for you if you are unable to. Start talking about the options before you turn 18 and have the needed paperwork ready to be signed when you turn 18. You also will need to start transferring your medical records from your pediatric providers to your adult providers. Once you have your adult physicians on board, give yourself a pat on the back for a job well done. And remember to help others and give feedback. Share the journey with those starting the transition process. They would love to hear any tips and tricks that you've learned along the way. As you transition, you have to become your own advocate. No one is going to remind you to take your medicine or to make your appointments. You have to keep track of your labs. You are responsible for getting to those appointments on time and ready to talk about your health care. You need to be the expert in your own medical care. Prepare for doctor's appointments like you were preparing for a test at school or meeting with your counselor. It might seem overwhelming to remember everything, including what questions to ask about transitioning, but up until this point, your parent or caregiver has taken care of things, but now it's all on you. Remember that no question is dumb. Even if you think a question is silly, ask it anyway. The more you understand about your disease, the better you will be able to explain it to others, including your doctors and other healthcare providers. Oh, there's some great ladies up there. As you go through the transition process, it helps to know others that you can share the experience with. Joining a support group online, such as through Facebook, like our young adults group, it can boost your self-confidence and help you feel less alone and give you ideas about how to make the transition as painless as possible. If you get tongue-tied or feel like you stumble when you try to tell others about ALGS and how it affects you, it helps to have an elevator pitch or a short explanation of the disease ready to share. The pitch might include things like what ALGS is, how it affects your body, diets, what medications you take regularly, whether you have had an organ transplant, and anything else that will help provide people who don't know about ALGS to help you understand you and the disease better. With ALGS, it's easy to feel like everything revolves around your disease. It's a big part of your life. Having a rare disease like ALGS can become all-consuming, and it's difficult to juggle it with school, friends, social life, and family stuff. It's important to remember that you are not your disease. You have ALGS, but it does not define you and who you are, which you all are, amazing young people with all kinds of talents, interests, dreams, and quirky behaviors, as I have learned. Part of understanding ALGS is knowing that it is caused by a change or mutation in the jagged 1 gene, or the notch 2 gene in some cases. That happens before a baby is born. The changed gene may be inherited from one or both parents, or may be the result of a new mutation in the child. A person with ALGS has a 50% chance of passing the disease on to each of their children. It's important for you to know this so that you can decide what is best for you in the future when you think about having your own family. Up there you will see a couple of good resources to help you through the transition process. We talked about GOT transition earlier in this presentation. The Global Genes Toolkit also is a good source of information and ideas. You might want to Google transition to adult care and check out some of the other resources that come up. All of these will help you surf through the transition process like a pro. ALGS Care is a new tool that we rolled out this weekend. Right here at the symposium. If you didn't get a copy and want one of your own, please let us know and we would love to give you one. This is a helpful tool to use when you are talking with doctors if you haven't done this on your own before. It includes a glossary of technical terms and what they mean, a guide to specialists and what they focus on, tests that you might need for different challenges you encounter, questions you might want to ask your specialist, and a place to make notes for reference later. It also includes the resources you need to manage your ALGS medically, no matter what comes up. There is still time to join our teen panel Q&A a bit later this morning, where I just want to let you all know. If you want to share your experiences with others here at the symposium, let me or any of the board members know, and we will get you up there and connect you on how to fill out a release form if you haven't already. This is a terrific opportunity to help others understand what you have gone through in your journey with ALGS. So now we're going to meet our panelists. We have Brianna James Beckham, we have Hannah Zeno, and we have Henry Lynn here to answer any questions you might have. So, if you all want to introduce yourselves a little bit, do you want to have them?
Do you want me to say, anything special?
You say what you want.
Okay. I'm Brianna James Beckham, and I, of course, transferred into adult care, age 18. My primary care doctor was like, okay, goodbye, you're on your own, find an adult person. I am pretty much halfway transferred, but my GI doctor decided that he'll keep me until, I guess he decides to kick me out. I don't know. He was just like, oh, you're 21 now. You can stay here. I have older patients, older than you. So I'm heart and vascular is all adult, and now my primary care is all adult. I'm just waiting for the GI person to kick me out. So.
I'm Hannah. I'm 20 years old, and I still go to a children's hospital. I go to Cincinnati Children's. And I'm kind of like looking at other hospitals, but my doctor said he'd treat me till I was 25, so I'm going to milk that until I'm 25.
Henry Lynn, work at Children's Hospital Philadelphia. It's always great to hear different perspectives about, from your standpoint, about what you're looking for with transition to care. I think from a physician standpoint, it's absolutely that. I mean, we want you guys to feel comfortable when you transition, and there's not really an age that's too young or too old. I think a lot of it just depends on circumstance. So I'm excited to learn about kind of what we can do to help out.
Okay, so does anyone have any questions before I start throwing some out there?
Dr. Lynn, is there, at CHOP, is there any sort of official program for transitioning patients out of your children's hospital there?
So not specific to Alagille at all. We do have just a hospital-wide transition program that really focuses on, I guess I would say, education and empowerment. And so essentially, we don't start at 12. I think it's physician dependent. So some people start earlier. So for example, one of the other hats I wear is I work with the liver transplant team. And so as soon as you become a teenager, we start really engaging you as during the visit. So we'll ask you like kind of what medications are you taking? Do you know why you're taking them? Do you know why you got a transplant and things like that? But I think hospital-wide, what we try to do is, by the time you kind of get into senior year of high school, we'll start introducing the concept to say, hey, what are your plans for next year? Are you planning on staying locally? Are you planning on going elsewhere? And really try to help find that ideal placement. I would say that for us, transition of care doesn't mean, okay, one day you're seeing us and the next day you're not. It's more of a, how do we get you to that place where you're more comfortable? So to that end, what we'll do is usually it's over a course of 2 to 3 visits. We'll say, let's introduce the idea of transitioning, start thinking about where you might want to go, but then also what tools do you need to be successful. And so sometimes it takes about a year. Some people, they don't even want any help. They just said, okay, I figured at 18 I'm going to leave, so they've already kind of done it themselves. I think for those of us working with liver diseases and in particular Alagille, the process tends to take a little bit longer. A lot of times, the transition happens over a couple years, and ultimately it is the GI doc that's the last person to transition, usually, whether it's, you finish college or even older.
Okay, so I'm just going to throw out some questions to you guys. So it seems like it's pretty easy to find pediatricians and pediatric specialists that know about ALGS, especially when it comes to liver doctors and cardiologists, but it's harder when it comes to adult doctors. What are some ways to find adult doctors, both primary care and specialists, who are at least familiar with ALGS and provide appropriate care?
Oh, okay. Yeah, okay. It's just really quiet. Well, I guess my way was easier because I didn't actually have to change. Well, okay, for my heart doctor, I just stayed with, I stayed with Stanford. My original heart doctor that had been seeing me since I was a baby retired, and because it was Stanford and we're all in on the Epic system, which is like the computerized system now for charting, she was just able to access all of my records and charts, so she already had it. So she knew about it, and working at Stanford, she had already kind of heard about it, and that was super smooth. I mean, we tried to go with one other cardiologist, and my mom really explained to her, or started explaining to her, like, okay, this is a heart thing, and she's got pulmonary stenosis and blah blah. And the heart doctor freaked out. She's like, oh my god, I don't know what to do, and blah, I can't take her. So we're like, okay, we're going back to Stanford, and we're gonna go with a cardiologist that actually knows what she's doing and has heard about this before and can easily get my records. So the heart transition was pretty smooth and simple that way. And my primary care doctor, I stayed with the same medical clinic that I had been in, like the Scotts Valley Medical Clinic. And luckily for me, my primary care doctor does adult and child, so she's got 2 degrees. So that makes it really easy if you can find someone like that, because then they know the ped side and the adult side, so they know kind of how to deal with both aspects of the whole disease and care system. So those were my smoothest transitions just because of that. So, cool, yeah.
So I think, you know, I think the hardest part is to keep in mind that, you know, even though some of us may be in great situations from a medical care standpoint and have physicians who really understand Alagille, it's still pretty uncommon. And so it's very much of a niche in which, you know, you need specialists. You want specialists who've seen at least more than one patient or person with Alagille, but at the same time, that may also be hard to find. But you take that, and when you're transitioning to adult care, now you're basically saying, so for all these diseases that adult physicians have to worry about, you know, Alagille is probably in the group of diseases in which they read about to say, oh, well, you know, there are some pediatric conditions that you may see in adult medicine. And so really it's, if you're lucky, you know, it's something that they maybe read about in textbook once, you know, or you know, maybe you're lucky that you're at a good institution where, you know, you do have an established transition program, so they know about these conditions. And so I think that transition can be difficult. A lot of it is going to be educating, and I think, like with any sort of relationship that you have with your physician or healthcare provider, I think what helps the most is if your new physician, your adult physician, actually talks with the pediatric physician to say, you know, well, what are things like such as with the heart issues? You know, so if you have peripheral pulmonic stenosis, PPS, you know, what does that mean in terms of screening for you as an adult? Does that just mean you have to get an echo, cardiogram, and ultrasound every couple of years? Does it mean that, well, you have this condition, but really there's not much to do besides just kind of watch and monitor you in case you have symptoms? Or do you have something that requires more in-depth care? And so I think the key thing with that is really, obviously you need to lead off with saying you have Alagille syndrome, but at the same time, to really get a good sense even before you make that transition from your specialist to say, you know, what's your opinion in terms of if I have a cardiac disease or a liver disease? You know, what type of care should I be looking for? What are things that I might need to anticipate happening in the next couple years? Because oftentimes, even though as pediatricians, we'll say, well, you know, you're getting a little bit older, we may not be so used to taking care of, you know, older patients, but we generally have a sense of what to expect in terms of, you know, if your liver disease is stable, what might be the monitoring steps for the next couple of years. And so I think those are just important things to keep in mind.
Just in the years I've been reading up on this and being part of the rare disease community, one of the things they suggest is see if you can get yourself attached to like a university or a teaching hospital. They're usually a little more flexible and willing to learn about your care and your needs for your rare condition. It can be really tricky, especially if you live in like flyover country, where you don't have a cluster of fine institutions like you would in like Stanford or across the street from UPenn or there in Philadelphia. So it gets a little trickier, but you got to be your own advocate and put a little elbow grease into it. And as far as finding someone who's actually going to take the time to learn about the disease as an adult provider.
Okay, so another big issue I know that I had when I was transitioning is learning. You go from having your parents ask all the questions, and you tell them your concerns, and they turn it into a question that sounds really smart, like they know it all already. And so, how do you transition from going to that and asking your own questions? How did you guys transition into that?
Normally what I would do is I would talk to my mom before actually going to the doctor, and she kind of like walked me through asking different questions and like writing them all down, and so then you kind of like get into the habit of doing that.
Yeah, I kind of did the same thing. I talked to my mom before. I definitely wrote down my questions, or even sometimes it's just a matter of, okay, we're talking in the car one day and I'm experiencing this, and I go, oh, Mom, I've been experiencing, my heart skipping beats. And she go, oh, well, you should probably talk to your doctor about that. And she kind of taught me to like carry around a little notebook. So I carry around a little notebook sometimes, or I use my phone and I just write it down right there. So I have my questions, because I know it can be hard, like when you're about to go to the doctor and you get all like, I get nervous. I have like PTSD now from my transplant. I'm like, so that I have my questions before I'm even trying to like come up with them in the spot, like, oh, what am I supposed to ask? What was the other thing the other day that I said to you, Mom? And then I just have it because I wrote it down the day that we talked about it, which is really helpful. So I suggest doing that. And then it's kind of hard. I still have my mom come into the room with me. It just gives me, comfort. And she, if I need, like, the doctor talk, since she's a doctor, it's really, I'm lucky that way. She's a doctor, so she knows all the doctor, talk. That can be really helpful, so she can actually, I still have her kind of talk to the doctor when, my doctor's talking in really big words that I still don't understand. And I'm going, okay, what are you saying? My mom can, talk to them and then translate to me. I just use her as a translator. And then I've had like my own questions come up, and I feel comfortable now just asking them. Be like, okay, hey. And I've been shy in the past, like, oh my God, I think this is a dumb question. But it's really not. So I'm comfortable now asking my own questions, even though they might seem weird to me. They're actually not weird to the doctor. But my doctor has told me, like, hey, if you have anything. Also, the doctor starts talking to you personally, so they'll come in the room and they'll actually greet you, which actually helps, because they're not just greeting your parents anymore. They'll actually do the thing where they switch. Yeah. And they start talking to you more, so then you're kind of like, okay, I have to talk to this person. This is all me now. But it's definitely a slow, like, for me, it was a slow transition. So my mom was there, she did all the talking, and then I slowly started to feel more comfortable. I think it's just a matter of also just gaining confidence within yourself and that advocacy, like standing up for yourself, but just really getting that confidence, because the hospital can be really daunting. It's daunting for me, so I kind of shut down. And that's where it's nice to have my mom still in the room, so if I start to shut down, she's like, okay, it's okay. And sometimes I still have her go like, oh, you wanted to ask questions, right? I go, oh, that's right. So I still need a little bit of help, but mainly through my notebook tool, I have learned to talk to my doctor and ask them questions myself. So
I'm going to add just a little bit there, along with Brianna. I know with me, it was like you said, the doctor starts dressing you, and if you don't see it coming, it's really uncomfortable, because like you're used to sitting in the corner like looking at all the fish on the wall because you're still in a pediatric hospital, and like, oh, that's new, and the doctor's like looking at you, and he's like, Anna, hi there. how you doing, Dr. B? Why are you telling me medical terms? So it can be really overwhelming. So it's important to know that eventually they're going to ignore your parents. Like, it's not that they just address you. They will ignore your parents because legally they are talking to you. And like, your parents can go back there. Like, obviously you've given consent when you bring them back there, but they are talking to you. And so it's really important to know that's going to happen. And it's a little freaky at first. And also, I learned that I'm just very blunt and honest when I have questions. Like, I'll tell my doctor, I'm like, all right, this may sound really dumb, but I think you'd rather me ask a dumb question and not have a worry than me not say anything. And he's like, yes, yes, no, ask anything. So don't feel scared to ask, even if your parents have like the correct term and they look at you and they're like, it's called this. I'm like, oh, well, he got it. He understood what I meant. So just don't be scared to talk. Does anyone have any?
So what are things that you found that have been helpful? Or I guess you talked about what was a little helpful, but I guess maybe not so helpful from either a parent or a provider standpoint when we're trying to help kind of engage you more? Because I mean, it's interesting hearing things like saying, oh, when we turn to you and start addressing you in particular, if you're not prepared for it, you kind of get blindsided a little bit. So to me, that's really interesting because, you know, it doesn't occur to me when I'm doing that. I'm just like, oh, well, you said hi, so I'll say hi to you, and we'll just start having a conversation. So I think it would be nice to know, like, what are things that we as, you know, either parents and or physicians that we've done that you think, yeah, you could do it a little bit differently and that might help us out a little bit better.
One thing is like having like regular conversations first and not like jumping into the medical stuff, because like making them feel comfortable. I learned about this in school, forgot what it's called, but when you make the person feel more comfortable, they're more willing to ask questions that are like kind of uncomfortable for them to ask. So.
Yeah, I definitely agree with Hannah on that one. Yeah, I mean, it's really uncomfortable when it first happens, it's really uncomfortable to have the doctor come in and be like just directly facing you and be like, oh, hi, how are you? So, how you doing? What's this? How's your heart? Is it, you know, still working, pumping? No. Yeah, so kind of like, I like my GI doctor a lot because he comes in and we have a good relationship where we just crack jokes with each other a lot, and then we get into like, oh, the serious stuff, like, oh, how are you doing? How's, you know, your liver levels or blah, blah, blah. That's what I really like, so I really that's why I can't leave him. I really like my relationship with my GI doctor because it's that comfortable situation established, and it takes also the edge off of just the hospital, just that daunting experience, like, okay, I'm here and I'm either going to get good news or bad news, and which one is it? And, you know, being sick, it was usually bad news, so it's like, okay, great, what news am I going to get today? And then, you know, going to the hospital too, it's like your disease is kind of thrown in your face. So you're coming in with all these feelings and all these worries, and you kind of just want to shut down and, you know, especially for me, I just felt I just want to shut down and close off. And so when a doctor comes in and starts talking to you directly and just jumps right into like, okay, you have this problem, let's talk about it. How are you? It doesn't help. But when my doctor comes in, he's like, oh, hi, ho, ho, ho. How you doing? What is today? You know, we got that alien out of your stomach, right? I'm like, oh yeah, just popped right out. Blah. Yeah. This is kind of like our usual jokes. It relieves a lot of that fear and uncomfortable feelings, so that I can go, oh, okay, this is good. We have a good relationship. He's cool. I'm still normal, I'm okay. All right, now let's get down to business. It's easier to take and hear the information even when you establish that kind of breaking the ice comfort relationship.
So I'm going to say a little about parents, and you might not want to hear this. I apologize. Please don't hate me. So parents, what helped me a lot was when my mother, I'm glad she did it now. At the time, I was not very happy, You need to make your child slowly but surely ask their golden question or address the doctor in a way that is not strictly, oh, how's school, how you doing, how's the band, how's soccer, whatever they're doing. You need to make them ask one question, even if it's just one. And it is awful the first time because you're angry and your mom is making you and you don't want to do it. But then it helps you a lot because then your doctor gets all excited because you're asking a question. Oh my gosh. And it's going to be really hard for you guys to watch us struggle because we're going to sit there for 5 minutes trying to find the words. And they don't have to be fancy words, but we think they do. So please, slowly but surely start, and y'all are going to be mad at me too, so I'm telling your parents to do this. I'm sorry, but it's for your own good. But so slowly but surely make them ask a question or at least make them say a concern. That's what I started out with. There was times when I didn't even have a question. I didn't know what I was asking. I just knew I was concerned about this. And that's how it started. My mom would look at me and be like, so, you want to tell him? I was like, it's fine. She's like, no, you're going to tell him. And Dr. B, my doctor, looked at me like, what do you want to know? What's going on? So make them uncomfortable. Sorry, guys. You're going to be really mad at me after this. But make them uncomfortable. Make them start. Because the sooner you start doing small things like that, the more confidence they're going to get to navigate the medical field and deal with all of it.
I know, when I was like 13, 14, my mom would hand me the clipboard and say, all this information, the date, the address, the phone number, just, you can fill that stuff out, you're going to have to fill all this stuff out many times in your life, get ready, even if it's just a small step towards it. And just to expand on that whole elevator speech as far as Alagille, that's, something you refine over, because you're going to be meeting people all your life. At some point, you're probably going to have to explain Alagille syndrome to them. So it's just one of those things, telling people about it, the better you get is through experience and just doing it and refining it and that sort of thing.
Yeah. And I know that a lot of young adults, I'm sure that you guys have your little spiel for friends who aren't in the medical field, obviously. You have a little spiel, oh, I have this, it does this, okay, I'm fine. And you can just build on that. You can put in more medical stuff that you don't say because you don't want to freak out your friends. That's what I started doing. I had a spiel for people who were outside of my family and didn't know me very well, but wanted to know something. And so you can have a spiel and take that and just build upon it, because obviously when you're talking to medical professionals, they're going to know what you're talking about. When you say you had a liver transplant, they're not going to flip. They're like, oh, okay, yeah, you had that done. So just build upon the spiel you already have. You have a question?
I'm going to do that whole mom put you on the spot again.
Oh, thanks. You don't do it enough.
Anna, when you went off to college, you were away from home, away from me, 6 hours from your doctor at that point. And I remember you having to address a situation at band camp.
Oh, yeah, you may talk about that.
Because, it wasn't major, but for you it was.
Yeah.
So the experience is, and you were by yourself. We were too far away. I couldn't be there immediately.
Unfortunately.
And so, why don't you talk about that a little?
So was it my freshman year? Oh gosh, that was awful. So my freshman year at band camp, you go about 2 weeks before classes actually start. And so my case of Alagille syndrome is pretty mild. I'm lucky with that. But when things like this happen, it doesn't matter how mild it is. So I woke up one day and there was a bump on my neck, really big. And obviously I didn't have that when I went to bed that night. And so I had to go to the doctor alone. That wasn't my own doctor or my primary care at home. And I was flipping out because I had never, like Joe had said, his mom made him fill out stuff, never done that, didn't have a clue. I was lucky to have my insurance card. Mom stuck it in my wallet for me. But they were asking me, so you take medicine? And you're like, what medications do you take? I'm like, oh, I know the names, I got this. And I was like, how much? I just pop it in my mouth. I don't know how much I take. It's on the, what? And that was honestly terrifying. It sounds really funny. It's funny now, but at the time, I remember I was so scared because I didn't know what to do. I didn't know what to say. I didn't know, You know, literally all I knew was I had this disease. I knew the name of the medications I took, and I knew my mom's cell phone number, and I knew my doctor's cell phone number and that was only because my mom, once again, made me a card that I put in my wallet, which I'd recommend for all of you. She put a card in my wallet that has her cell phone number, the Cincinnati Children's, where I go, and has their institution, their address, my doctor's cell phone number, and who to call, and I also have a medical alert bracelet now that says my disease, and it has her number and my doctor's number, because it was honestly one of the most terrifying experiences ever, because I didn't know, because at that point it was all on me, so if something happened, it was my fault. It was not the doctor's fault who were treating me, it was on me. So it's funny now, like it's really funny now, because I was like, oh gosh, I was just a baby. But it was terrifying. Like I remember crying and calling my mom, and she was like 2 hours away, so what was she gonna do? So yeah, especially when you go up to college, know your stuff enough to be able to navigate, because if you go to a doctor like I did, they're going to question you on if your disease is real. That happened. And I had to have him go Google it in front of me because he didn't believe me. That was also fun. Really added a lot to that situation. But yeah, no. Yes, oh, and the medication cheat sheet, thank you. I also have a medication cheat sheet that I keep in my wallet and on my phone, and it says what medicine I take, how much it is, how often I take it, and the other names for it as well, because you know Ursodiol has like 3 or 4 different names and stuff like that. And also for those of you who have had transplants, you know, you need to have your medical history, especially the big stuff like that. They need to know things like that. And if you don't take pain medicine, like I'm really not supposed to take pain medicine. I had to tell them that immediately so they wouldn't try to give me anything. So those are really good. A cheat sheet with the medicine, something in your car. My mom had it laminated for me with her number and her doctor's number. If you want to go so far as to have a medical alert bracelet, it just makes me feel better. I know a lot of people who don't, but I also know a lot of people who do. Just for in case something happens, it's right there. All they have to do is call, and they'll get my mom or my doctor, and it's all taken care of. So, yeah. That cover it? Okay, cool. Just making sure I got everything. Oh yeah, I made it. It's gone now. I didn't tell the end of that. I figured you knew I made it. Survived that traumatic experience.
So, how many of you have medical alert bracelets? Because I've thought about that, but then I kind of thought that, yeah, they're going to see this word on here, and what is that going to mean to anybody? Because no one else has heard of it. Because we live we have like 3 people in our state.
Mm-hmm. What I have on mine, I have Alagille syndrome, and then underneath it I have rare liver disease, because that's how it affects me. It's just my liver. So whether it's something else, you can put on there. But I put it on there because, like you said, people don't know what it is, and I don't want them to be Googling my disease while I'm like unconscious. So yeah, I just put rare liver disease. We put rare liver disease at the bottom, so they have some idea of what they're dealing with. What they're zoning in on. Right. Yeah.
Yeah, I went through like 3 bracelets when I was a kid, so I just stopped wearing them, just out of practicality's sake. So.
But also, if you want to talk later, they have a lot of really cool sites for like younger kids and older kids that have like really fun ones. We found a site. I wish I had known about it when I was younger. They have like really fun bracelets or like cheetah print and flowers and stuff. I mean, mine's just plain, but yeah, they have a lot of cool places.
Mine has hearts on it.
Yeah, we're
Yeah,
cool.
looks like a regular bracelet. It's pretty cool.
Yeah, I have a necklace, and it's like a dog tag or something.
So we obviously all know that this is a very serious disease, and so at what age did your parents give up control of your medications? When I still remind my son and to let him know to take his medication. At what age did you guys start taking your own medication?
Well, my mom still reminds me when I'm home, but I think that's based off of like habit. And but I started like learning how to like put in my little medicine box and how much I took and the names at high school, because my mom knew that I'd go away to college and I'd have to learn to take it on my own. And she used to like wake me up. I take medicine at 6 a.m. and before I left, she used to wake me up. So then I had to learn how to wake up to an alarm and like take it that way. So.
I think I started learning in 7th grade. And my parents kind of laid it out with me before that, and then I was kind of on my own starting 7th grade and then onward. And I don't think your parents or you are ever going to stop kind of reminding your child to take their medicine. My mom still, asked me if I took my medicine. I'm like, yes, Mom, I took my medicine. It's okay. Before my transplant, I was on a lot of medicine, so I can understand her worry because it's a lot to keep track of. But we got out the pill containers, the week, and we started filling them, and she taught me how to fill them. And so I did that for a while, and then now I just take them out of the bottles. And I was able to reassure my parents that I understood the importance of taking my medicine. And I would even ask my parents, like, oh, what does Actigol do for me? And my parents would tell me what each did, which I think really helped with my understanding of, oh, this is important because this is going to help this. And I've always looked at my medicine as I feel good today because I'm taking this medicine. And so I've never really had the feeling of, oh, I'm good, I don't need to take my medicine. So my parents were really reassured because I had a strong understanding and belief that I'm feeling good and I'm okay today because I took my medicine. So I think if you can, if your child or whoever you're taking care of can give you that reassurance, I think you can feel pretty reassured. But I don't, you're a parent, you're worried, and that's totally fine and normal. And you can give up control when you feel that they're really on top of it. But I don't think you should feel like you ever have to stop reminding them. Because, I kind of like it that my mom still kind of reminds me. Because it's like, oh, hey, I'm off at college and I'm doing my own thing. And my mom's like, oh, have you been taking your medicine? I'm sorry. I'm like, oh, yeah, you care. Okay. Yes, I've been taking my medicine for you. So, yeah.
Sorry, I'm trying to find the right words for this. We are very good at acting like we don't know how serious our condition is. We're very good at that, and that is because we are generally, except for the rare occasions we're here, we are generally around people who are healthy, and so it is much easier for us to not pretend, but we like to think of ourselves as healthy when we are in those situations. But not that anyone is, but don't for a second think that we are not aware that what we have is serious, that what we have is terrifying at times, and there's a big unknown question mark. We know that. And so, because I have heard, not anyone here, but I've heard some stories of parents who sit their kids down like, if you don't take your medicine, you're going to die. That doesn't help us. That just freaks us out, and we want to run away. Whereas saying like, hey, this medicine does this for you, this medicine does this for you, this is why you're not itching as much, this is why you have more energy, that helps us like understand. And also, me and my mom fought a lot with this, and at some point, like we've never given up, like it doesn't just stop where you just one day like, I'm not going to remind you anymore, you're on your own. We're not going to put anyone in that situation, but at some point, you just have to look at your child and be like, all right, look, it's on you. I'm going to remind you, but you can lie to me, you can throw away the pills, I'm not going to know. But I'm going to remind you because it's my job, but something, it's on you. At some point, it's not going to be all on you guys.
Yeah, just in my family growing up, we had pretty much had an agreement. If I'm not going to take my itch medication, then I can't complain about being itchy.
Yeah.
As simple as that.
Yeah, and it's,
Real quick, we're running out of time here.
I just want to say thank you for saying that about the medication, because I'm guilty. I'm a guilty parent of saying you're going to die if you don't take that. So it's really good to know that, that's a good suggestion to really tell him, what the medication is for and how it's beneficial. So thank you.
Yeah, no problem.
That's the thing about the whole fear-mongering thing is once they don't take the medicine and they don't die, your credibility is completely out the window. It goes for a lot of things too. I'm not just taking medications, but just saying.
Oh.
Are there any adult doctors that are transitioning to try to understand Alagilles more? I mean, we have a small group here, but in the symposium, there's so many young kids here. And in the next 10, 15 years, they're all going to be transitioning to adult care. So maybe this is for the doctor up here. Are we seeing any adult physicians beginning to be able to want to tackle this from an adult medicine side?
So I think there's always the desire to do it. I think it's still limited by how rare it is. I think, like we mentioned earlier, a lot of the adult doctors who are aiming to learn more about it they're located at academic institutions, at places where you already have an existing group of pediatric people with Alagille syndrome. So in Philadelphia, it's a pretty when your adult hospital is right next door, we know from a physician standpoint which physicians are interested, or not only interested, but are going to really be a good match from a clinical standpoint. I think you're going to see it more frequently probably in heart and liver. Heart's interesting because there's a lot of congenital heart diseases in which now that the medicine's better, your survival rates are improving, and so that's a natural area where there's a lot of cardiologists who realize that there's a need to understand about pediatric conditions. Now they may not understand Alagille in particular, but they understand tetralogy of Fallot and peripheral pulmonic stenosis and the cardiac diseases that can be associated with it. And so I think that's an initial starting point right there. Just one last thing, this is also an area where sometimes if you're looking for physicians, there's also physicians who have previously been trained in either as a family physician or in what we call med peds, so they're trained both in medicine and pediatrics. That's not always going to be very prominent on their display board to say, I'm trained in medicine and pediatrics, but I think a lot of our training is pretty readily available if you go online and look to see, where was the physician trained, what are they specializing in, and if you look at their residency training program, if it says med peds, that's usually a sign saying they at least have shown at some point in time in the past that they've been interested in pediatric issues, and so that they've at least had some basic training in it. So I find that that's actually a pretty good place to start as well.
All right, so I guess we ran out of time here. Thank you, Dr. Lin, for being on our panel. Thank you, ladies, for putting yourselves out there. Thank you, Anna, for the presentation, and thank you all for joining us. And feel free to ask us questions one-on-one, or like I said, we're pretty open. So.